Welcome, everyone. Look, are you feeling totally overwhelmed by the thought of taking the APC Certified Professional Coder exam? Well, take a deep breath, because you are exactly where you need to be. Welcome to Part 1 of our ultimate 100-part CPC study guide series. We're going to decode this massive exam together, step by step, until you're fully certified and ready to conquer the medical coding world. Before we get started, make sure to like, share, and subscribe to Decode Healthcare with Harshal. Let's dive right into the explainer. So, here's our game plan for today. We're going to cover 1. The CPC exam explained. 2. Exam format and rules. 3. Exam domain breakdown. 4. Career opportunities. And finally, 5. Strategy and next steps. All right, kicking things off with Section 1, the CPC exam explained. So what actually is the CPC? Well, the CPC, or Certified Professional Coder Certification, is developed by the AAPC, and it carries immense industry weight. I mean, it's literally the gold standard for aspiring medical coders. Successfully passing this standardized test proves to employers across various healthcare settings that you have the professional skills to accurately and critically, ethically code medical records. Think of it as your golden ticket into the profession. Moving right along to Section 2, Exam Format and Rules. Let's talk about the hard constraints you're working with. Number 1, 100. That's the exact number of multiple-choice questions you're going to face. There are no essays here, no tricky fill-in-the-blanks, just 100 clear-cut multiple-choice scenarios. Number 2, 4 hours. You get a really generous 4-hour time allotment to work your way through those 100 questions. And honestly, what's great is that it can be administered either electronically or in a traditional paper format at approved locations, so you can test in whatever way makes you feel the most comfortable.
And a final number, which is maybe the most important one to hear right now, 70%. The AAPC typically requires approximately 70% correct responses to pass. This is a huge relief, right? Perfection is absolutely not required. You do not need to memorize every single obscure code. You just need consistent, solid accuracy. All right, let's look at Section 3, Exam Domain Breakdown. This is all about where you actually need to spend your time studying. When you look at the actual blueprint of the exam, you'll see a massive chunk, roughly 60%, is testing your knowledge of CPT coding. The next largest slice is ICD-10-CM diagnosis coding, which sits at about 20%. Then, HCPCS Level 2 and modifiers make up another 10%, and finally, your medical terminology, anatomy, and compliance fill out that last 10%. This breakdown is your study map. It tells you exactly how to budget your study hours. Let's drill down into that massive 60% CPT chunk for just a second. To master CPT, you've really got to conquer its specific subsets. You're going to be tested heavily on surgery, which is actually the largest single portion of CPT on the exam, along with medicine, radiology, pathology, and evaluation and management, or EM for short. Don't stress, though. We're dedicating specific parts of this 100-part series to absolutely every single one of these subsets. Okay, Section 4. Your future career opportunities. Let's talk about the incredible payoff. Earning your AAPC credential opens up some seriously diverse pathways. You know, you could become a medical coder, assigning those accurate codes day to day. You could be a billing specialist, overseeing claims, or a compliance officer, making sure federal regulations are met. Maybe you step into the role of a coding auditor, evaluating accuracy, or even a revenue cycle analyst, improving financial strategies for massive healthcare facilities. The opportunities are very real, and they can be incredibly lucrative. Wrapping up with Section 5, Strategy and Next Steps. Here is your study roadmap. Here are your empowering, bite-sized next steps to take right now. Step 1, understand the domain structure we just reviewed. Your study time must reflect those exam weights. Step 2, go get your official coding manuals. I mean, you literally cannot pass an open book test without the right books. And Step 3, master the core competencies, step by step. Look, the CPC exam is entirely predictable if you just follow a structured plan, which is exactly what we're providing you here. So, to recap, you now know about the 100-question, 4-hour format. You know that CPT is the undisputed heavyweight of the exam, and you've seen the awesome career paths waiting for you. So, are you ready for the next step? In Part 2 of this explainer series, we are tackling medical terminology. We'll be breaking down the fundamental building blocks of medical words and introducing you to our minimal memorization decoding method. Trust me, it's a total game changer. Keep reviewing that domain structure, get your manuals ready, and I'll see you in Part 2.
Until then, ask yourself, are you ready to stop just reading medical records and finally learn how to speak the universal language of healthcare?